Start every extraction by using the straight 301 elevator for 15 seconds in your usual fashion. The tooth will move in the mesial-distal dimension. Now, to achieve movement in the buccolingual dimension, use the expander. Place the instrument into any of the 4 line angle corners in an upright position about 20 to 30 degrees off the long axis of the tooth. With moderate force, push into the sulcus and twist. Keep pushing and twisting for 15 seconds. Now go back to your 301 elevator for 15 seconds, then back to your expander again for 15 seconds. In most cases, just 2 passes with the instruments are needed to loosen the tooth or root enough for an easy, trouble-free extraction. In rare cases, if you're dealing with hard, dense bone, you may find it difficult to get a good purchase point to achieve movement. In this case, you can open up the PDL and create a notch. Use a thin diamond like our product, the Flame, angled back slightly. Now go in about 3 millimeters into the sulcus to create a purchase point for more leverage for your elevator. For tip preservation, avoid bending the instrument back like a shovel. Also, do not go into the interproximal with the instrument. This is where you use your 301 instead.